Exotic veterinary medicine has come a long way, but let's be honest, it's still got a bit of that Wild West or MacGyver energy. Not long ago, treating exotic pets meant relying on guesswork, anecdotal evidence, or simply extrapolating from dogs and cats. But today, things are changing. We have more research, more specialists, and more resources than ever before. And that means we have a responsibility to provide better evidence-based care for all of our patients, exotics included. If you're a general practitioner or vet tech who treats or wants to treat exotic pets, this video's for you. I'm Dr. Kristen Turner, and I'm a veterinarian board certified in exotic companion mammal practice. I'm going to break down why evidence-based exotic vet med is the future, how you can stay ahead of the curve, and the key resources that will help you provide the best possible care. Let's dive in. For years, exotic veterinary medicine was kind of like the Wild West, uncharted territory. We had very little research, minimal guidance, and few specialists to go off of. That meant a lot of well-intentioned trial and error. But today, things are different. We have more data, more specialists publishing research, and a growing client base that expects high-quality care. That's a great thing, but it also means we have to rise up to meet these new standards. Here's the reality. There aren't enough exotic specialists to meet the demand. And let's be honest, not every GP wants to or has the time to go through the process of getting boarded in exotic veterinary medicine. But that doesn't mean GPs shouldn't see these patients. Many have developed incredible expertise over the years. The key is making sure that your expertise is based on science, not just experience. Exotic pets deserve the same standard of care as dogs and cats. That means knowing when to treat, when to perform additional research, and when to refer to a specialist. I want to share a quick case that illustrates why evidence-based medicine matters. I recently treated an Amazon parrot who kind of broke my heart. Months earlier, he had been seen at his regular veterinarian for weight loss. He performed blood work, which showed a uric acid of 16 milligrams per deciliter. So that's well above that 10 mg per deciliter threshold that typically warrants further investigation or intervention. And unfortunately, no treatment was initiated, just a recommendation to monitor and recheck in a month. When he came back in for a recheck, his uric acid had now risen to 24 milligrams per deciliter. And if you're not familiar with avian blood values, that's pretty equivalent to a dog with a creatinine of over 5 mg per deciliter. His calcium phosphorus product was well over 100, which is a major risk factor for metastatic mineralization to start happening in the organs. And yet, once again, no intervention was performed, just another wait-and-see approach. Frustrated, his owners sought referral on their own, and by the time I saw him, his values had begun to improve, but he was severely emaciated. He had bilateral renomegaly and mineralization within his kidneys and his testicles. He's making slow improvement now, but the delay in care may have cost him years of his life. In this case, whether earlier intervention would have prevented permanent damage, we won't ever know. But what we do know is that in cases like this, waiting can be the wrong choice. Cases like this demonstrate why some specialists discourage general practitioners from treating exotic pets. Picking up the pieces when cases go wrong is frustrating and heartbreaking. But I don't think the solution is for GPs to stop seeing exotics. I think the solution is better education, better resources, and better decision making. So how do you know when to refer? There's a couple of questions you can ask yourself. First, do I have the knowledge and equipment to diagnose and treat this case appropriately? Have I consulted current literature or specialists? Is the patient stable enough to attempt treatment, or would a delay risk their health? If the answer to any of these is no, referring is the best decision for the patient. I find that one of the most powerful things you can say as a vet is, "I don't know, but I'll find out." That doesn't mean you don't care or don't have the capability to get the knowledge. It means that you do care. You're committed to finding out the right answer instead of just guessing. Take the time to research current literature, reach out to colleagues and specialists. Use those resources you have available to you. Which brings me to my next point. Where can you find the best evidence-based information on exotic pet medicine? If you're serious about improving your exotic pet care, here are my top recommendations. Join professional associations. So there are member groups for both avian, reptile and amphibian, and exotic companion mammal veterinarians, which all offer published journals, online resources, and community discussions on their respective case types. Free online resources like Lefebvre Vet and Oxbow Vet Connect offer articles and care guides for a variety of exotic pet species. And then continuing education, conferences, and online courses like Exotic Vet Med Essentials, which provide structured learning and case support. If you're ready to take your exotic pet care to the next level, I've got some great options for you. Check out my Exotic Vet Med Essentials course. This is a 6-week course designed for busy general practitioners who want to feel more confident treating exotics, and it gives you 12 race-accredited CE hours. Sign up for my email list to get my best exotic vet med tips, updates, and exclusive access to my newest offerings. And then stay tuned for the Inner Circle, my new small group coaching program for veterinarians looking for consistent hands-on case support. Exotic pets deserve top-tier, evidence-based medicine, just like any other patient. Let's make sure we're providing it. If you have a question or a case you want to discuss, drop it in the comments below. I'd love to hear from you. Thanks for watching.